They found him alone, slumped forward in his recliner. TV still on, robe still open. No cry for help, just silence. To the world it looked like natural causes, but to those of us who understand the body, it was something else entirely. A slow hormonal collapse. Not because of disease, but because of neglect. And sadly, he's not the only one. Every year, thousands of older men slip quietly into decline, physically, sexually, emotionally, thinking they're doing the right thing by giving up what they believe they no longer need. But here's the truth. No one tells you. When you stop masturbating in old age, your body doesn't go into pause mode. It begins to deteriorate, silently. Your strength fades, your testosterone crashes, your prostate clogs, your spark disappears, and by the time you feel the effects, you're already years behind. But that's not your fault. It's what you were taught. And now it's time to unlearn the shame and replace it with real answers. So before we go on, if you care about protecting your body, your identity, and your independence, hit the subscribe button and turn on notifications now. And if you're listening, type 1 in the comments if this speaks to you, or 0 if you're skeptical. Either way, your voice matters. Let's talk about what no one else will. He walks into my office, late 60s, maybe early 70s. Fit, sharp, still working part-time, but there's something in his voice, something uneasy. "Doc," he says, "I haven't had a morning erection in months, sometimes not even with touch. It's like something just stopped working overnight." And here's the part that breaks my heart. He's not alone, not even close. Men assume this sudden change is a mystery, but it's not. It's biology, and it's predictable, especially if no one ever told you the truth, because here's what most older men don't know. When you stop all sexual activity after 60, including masturbation, you don't just lose the desire, you lose the function. Let me put this plainly. Your penis is not just decoration. It's an organ like your heart, your lungs, your muscles. And just like any other organ, it needs blood flow. It needs oxygen. It needs activity. Without it, the tissue starts to harden. Not in the way you want, but in the way that leads to fibrosis, nerve damage, and eventually irreversible dysfunction. It happens slowly, quietly, without warning. One day your morning erections fade. Then even fantasy or physical stimulation doesn't work. Eventually even medications don't help, because the system that supported it has shut down. This isn't about obsession. It's not about chasing youth or proving anything to anyone. It's about circulation, preservation. It's about reminding your body that this part of you still matters. Think about it this way. If you stopped using your legs for 6 months, what would happen? You'd lose muscle, coordination, maybe even forget how to walk. The same principle applies here. What you don't use, you begin to lose. And for men, once the erectile system begins to shut down, it becomes extremely difficult to bring it back. Yes, some men recover with therapy and treatment, but many wait too long. They think abstaining is mature or disciplined. They don't realize it's actually the start of functional decline. And the worst part, no one told them. I've seen strong men who built businesses, raised families, served in the military, sit across from me with tears in their eyes asking, "Can I get it back?" And the answer is, sometimes yes, but not always. That's why consistency matters. Not indulgence, just attention. Even once or twice a week can make a difference. It keeps the blood flowing, keeps the tissues responsive, keeps the nerves alive. Because this isn't just about intimacy. It's about your confidence, your identity, your sense of being connected to yourself. Losing function in this area isn't just frustrating, it's devastating. It changes how you feel about your body, about your relationships, about your masculinity. And here's the truth so many wish they'd heard sooner. This outcome is preventable, completely preventable. Not through expensive procedures, not through pills and surgeries, but through simple consistency, through allowing your body to remain active, engaged, and respected. So if you've noticed things changing, if spontaneity is gone, if you're avoiding touch, if your confidence is fading, don't wait. It's not too late. But it does start now. It usually starts subtly. A man stops feeling like himself, but he can't explain why. He's not as eager to get out of bed in the morning. He skips his morning walk. His appetite changes. He feels tired for no reason. His mood, flat. And deep down, something just feels off, like something important is slipping away. In my clinic, I've seen this story play out more times than I can count. Men think it's just aging, stress, bad sleep. But when we run the labs, we often find the real issue. Their testosterone has crashed. And not just from age, but from a complete absence of sexual stimulation. Here's what almost no one tells you. Masturbation, regular, healthy, respectful, is one of the few natural ways for older men to stimulate testosterone production. Not because of fantasy, not because of lust, because of biology. During sexual arousal, your brain lights up. Dopamine increases. The hypothalamus activates. Your testicles get the message, keep producing testosterone. Keep this system alive. But when weeks or months go by without that stimulation, your body gets a different message. It thinks that function is no longer needed, so it starts shutting down. Your hormone production slows, your energy drops, your focus disappears, your strength weakens. And what makes this so dangerous is how easily it's dismissed. Men blame their job, their age, their stress. They say things like, "I'm just not motivated anymore. I'm too tired to care. I don't feel like the man I used to be." And they're right. Because biologically, they aren't the same man, not without testosterone supporting them. Low testosterone isn't just a number on a chart. It affects everything. Muscle tone, bone density, heart health, even your ability to handle stress. It impacts how you show up in your relationships, your work, and how you feel about your place in the world. One of my patients, a retired firefighter, told me, "Doc, I don't even recognize the man in the mirror anymore." And the look in his eyes, it wasn't about vanity, it was grief. He wasn't mourning the loss of youth, he was mourning the loss of himself. And the saddest part, it didn't have to happen. With just a bit of education, with a small but consistent habit, he could have preserved his vitality. Not forever, but for years longer. He thought giving up self-pleasure was responsible, respectable. He thought it made him stronger, but it actually made his system weaker. Because here's the truth. Once your testosterone crashes in older age, bringing it back isn't easy. It takes months, even years of therapy, sometimes medication, sometimes injections, thousands of dollars. And for many, it never fully returns. But the good news, that crash is not inevitable. Even a simple private act done once or twice a week can help keep your hormonal rhythm stable. It keeps your brain signaling. It tells your body this still matters. Stay alive. Stay strong. It's not about ego. It's about preservation. It's about respecting the systems that keep you alive and well. So if you've been feeling off flat, disconnected, low on energy, low on drive, this may be the signal your body's been trying to send. And now, you can finally answer it. Here's something almost no one talks about. And yet it affects millions of older men every single year. It's not deadly, but it's uncomfortable, persistent, and slowly it starts to chip away at your quality of life. I'm talking about prostate congestion. Now you might be thinking, what does that even mean? Let me explain. Your prostate is a small gland about the size of a walnut located just below your bladder. Its main job: to produce a portion of the fluid that makes up semen. But here's the part most men don't know. That fluid doesn't just vanish on its own. It has to be released. When a man goes for weeks, months, even years without ejaculation, that fluid builds up. And the result? Stagnation, swelling, congestion in the prostate. Some men feel a constant dull ache in the pelvic region. Others feel pressure when sitting down. Some experience a frequent urge to urinate, even if the bladder's not full. And sadly, many are told it's just part of getting older. But that's not entirely true. In fact, one of the most effective ways to keep the prostate healthy is regular ejaculation. Yes, really. Studies show that men who ejaculate more frequently have lower rates of prostate inflammation, and in some cases, a reduced risk of prostate cancer. Why? Because the act itself clears out. Old fluid reduces stagnation and helps prevent harmful buildup inside the gland. It's like changing the oil in your car. You don't wait until it breaks down. You maintain it to keep things running smoothly. I had one patient, a 74-year-old widower, come to me with constant discomfort in his lower abdomen. He'd been tested for infections, scanned for tumors, prescribed all kinds of pain meds. Nothing worked. Until I asked him one simple question. When was the last time you ejaculated? He looked stunned, said it had been years. So I gently recommended a routine, just once or twice a week, in whatever way felt respectful and private to him. 2 months later, he returned. No pain, no pressure, no more midnight trips to the bathroom. And he said, "Doc, no one told me this could help. I wish I knew sooner." That's why I'm sharing this with you now. Because too many older men are suffering in silence. Not from disease, but from lack of awareness. You're not broken, you're not weak, you're not doing anything wrong. You just haven't been told the truth. Your prostate needs movement, circulation, release. Without it, things start to back up. And that backup leads to inflammation, pain, and fear. So let me be clear. This isn't about sex. It's about health. It's about maintenance. It's about keeping one of your most important glands functioning the way it was designed to. And yes, you have the power to do that. Quietly, safely, and with dignity. Don't let shame or outdated beliefs keep you from feeling comfortable in your own body. This is self-care. This is strength. This is your right as a man. Let me ask you something personal. When was the last time you truly slept through the night, woke up refreshed, with a clear mind, and a sense of peace in your chest? If you're over 60, and especially if you're over 70, you probably know what I'm talking about, that slow, creeping decline in sleep quality. You toss, you turn, you wake up at 3 a.m. for no reason. Or maybe your bladder won't let you get through the night. But what if I told you that something as simple and natural as regular sexual release could help restore your brain's rhythm and dramatically improve your sleep? Because here's what the science is finally catching up to. Ejaculation isn't just about intimacy. It's directly tied to your nervous system, your hormone balance, and your sleep architecture. Let's break this down. When a man ejaculates, his body releases a flood of calming chemicals: dopamine, prolactin, oxytocin, and serotonin. These aren't just feel-good hormones. They are the body's natural sedatives. They slow your heart rate, they quiet the mind, and they prepare your body for deep, restorative rest. That's why so many men, regardless of age, report falling asleep faster and sleeping more deeply after release. But here's what's even more important for older adults. Those chemical changes also protect your brain. Let me explain. Deep sleep, the kind that actually heals your brain, is when your body flushes out toxins from your nervous system. It's during this stage that your brain resets. Memory is consolidated, stress hormones are regulated, and inflammation is reduced. Now imagine what happens when you go weeks or months without triggering those sleep-promoting hormones. Your body doesn't settle down as easily. You stay in the lighter stages of sleep. Your brain doesn't detox fully. You wake up groggy, forgetful, and emotionally drained. Over time, this poor quality sleep adds up. It becomes harder to focus. You feel irritated for no reason. You start forgetting names, appointments, why you walked into the kitchen in the first place. And many older men think that's just aging, but that's not always true. In fact, some of the most common signs of age-related cognitive decline are closely linked to sleep disruptions, and those sleep disruptions can often be improved by simply taking care of your body's most natural needs. A 2020 study found that older adults who maintained regular sexual activity, including self-stimulation, reported better sleep, sharper memory, and even lower levels of anxiety and depression. It wasn't about youth. It wasn't about performance. It was about connection to their own bodies, to pleasure, to calm. Think about it this way. Ejaculation isn't just physical, it's emotional, it's chemical. It's your body's way of resetting the nervous system, like pressing the restart button on your stress. And in a world that constantly floods us with noise, with worry, with reminders of how old we're getting, this simple act becomes even more important. I had a patient 68 years old tell me he hadn't slept more than 4 hours a night in years, tried all the medications, cut out caffeine, even bought one of those fancy mattresses. Nothing helped. Until I gently asked about his intimacy habits. He admitted almost with embarrassment that it had been over a year since he'd had any release. So I gave him permission. Yes, permission. To reconnect with his body. To remove the guilt. To honor this natural part of himself. 2 weeks later, he came back, smiling. Said he was sleeping 6, sometimes 7 hours straight. His wife even noticed he seemed calmer, lighter. This isn't magic, it's biology. And more importantly, it's your birthright. You deserve rest, you deserve clarity, and you deserve to feel at peace inside your own mind. Let's keep going. So here's the truth. Most people won't say out loud taking care of your sexual health after 60 is not indulgent. It's not shameful. It's essential. It affects how deeply you sleep, how clearly you think, how strong your immune system is, how connected you feel to yourself, and even to the world around you. You've heard the science. You've felt the signs in your own body. Now the question is, what are you going to do about it? Because ignoring your body's natural needs doesn't make them go away. It just makes you more tired, more irritable, and more distant from the vibrant, alive version of yourself that still exists within you right now. So let this be your reminder. It's never too late to reconnect with your vitality, to care for yourself fully, to honor every part of your being, including your need for release, rest, and restoration. If this message spoke to you even a little, I want to hear from you. Leave a comment below. Type 1 if this helped you understand your body better. Type 0 if you're still unsure but willing to learn. And before you go, hit the subscribe button and turn on notifications. Because here we talk about the real stuff, the things most people are too afraid to say, but that can change your life if you listen. You're not alone in this journey. We're in it together.